I'm Dr. Agarwal, and I'm an attending neurologist at the Booth Gardner Parkinson Center in Kirkland, Washington. And I'm also a clinical professor at the University of Washington. And I would like to thank the NWPF for this opportunity to present at the HOPE conference. And today we are going to review some of the research opportunities that we have for Parkinson's disease at Evergreen Health, and also how you can take a more active role in the development of new therapeutic options for Parkinson's disease. So, PD takes a village to get the best treatment options. And part of that team, the center is you, and around you are your primary doctor, your neurologist, other specialists, PT, OT, speech, social worker, community support groups, family, and caregivers. And uh, a central part of this treatment team is also your research team. So, in addition to obviously these other professionals, education, exercise, gratitude, and participation in research optimize outcomes. So, Parkinson's disease trials that are available at Evergreen, we've categorized that into recently diagnosed treatment options for motor symptoms and non motor symptoms. Now we know that a large part of Parkinson's comprises alpha synuclein that's present in Lewy bodies in the brain. And a lot of the treatment options, especially the research options for Parkinson's these days, are looking more towards protective or medications that may possibly slow the progression of the disease. So early in Parkinson's, a lot of these trials are early PD in which people are not yet on symptomatic treatment. And for some of the trials do allow MAO-B inhibitors. And in general, if one does decide to go for symptomatic treatment of early PD, MAO-B inhibitors like selegiline or rasagiline are good therapeutic options. One could start carbidopa, levodopa too, but this is also an ideal time to possibly participate in a trial for a neuroprotective agent. So among the recently diagnosed trials in Parkinson's at Evergreen, we may soon be having a trial coming up which will actually allow addition of a neuroprotective agent on top for patients who are already also on carbidopa levodopa. In addition, we have the PROSEEK trial. So this gives a little snapshot of the trials we have available, and you can find more details on our research website. But there's a Neurally trial, which looks at a subcutaneous exenatide analog for possibly slowing disease progression in Parkinson's disease. This medication, a similar form, is approved for diabetes. It does not cause hypoglycemia. When you use it in Parkinson's, patients would need to inject themselves weekly. In the PROSEEK clinical trial, we are looking at an oral agent, and it's a tyrosine kinase inhibitor. And it's a phase 2 trial, so there is chance of being on a placebo, as it is with the Neurally trial too. And basically, this trial is looking to see if a tyrosine kinase inhibitor can slow the degenerative process in Parkinson's. We also have the TEMPO trial, which is looking at a D1, D5 partial agonist to see if it may possibly be better tolerated than some of the currently available dopamine agonists that are available. And there's the Pharma 2B trial looking at a low dose combination of pramipexole and rasagiline for treatment of Parkinson's. And these are currently approved medications for Parkinson's. This medication is looking at low dose combination treatment for these agents. Like I mentioned, the exenatide is used to treat diabetes. And there is some thinking that if it's injected subcutaneously, it may slow disease progression in Parkinson's. For the PRO-C clinical trial, patients may get the active or the placebo. And there are a total of 12 visits, and the total duration of the study is a little less than 1 year. Pharmatool, like we discussed, combination of rasagiline 0.75 and pramipexole. Now, this trial, there is a growing interest in looking at antibodies for treatment of Parkinson's. And like in any new development, there are bumps along the way. And so right now, there is active immunization, there's passive, so there's one of the trials that was recently completed was injections of antibodies against alpha-synuclein. And though that trial was closed, we've learned lessons from that trial. And there are other trials in the making or other trials that are in process also looking at other antibodies against alpha-synuclein. We also have trials for motor symptoms. Now, this slide outlines the currently available treatment options for Parkinson's. It includes various formulations of carbidopa, levodopa, which is Sinemet, Sinemet ER, Rytary, which is a combination of IR and ER, and also intestinal gel, Duopa. We have several dopamine agonists that are currently FDA approved, including pramipexole, ropinirole, rotigotine, and apomorphine, which is available in injectable form, but now also in a sublingual film form called Kinmobi. And we have MAO-B inhibitors, selegiline, rasagiline, and sulfonamide. COMT inhibitors, Comtan, Stalevo, Tasmar, and the newer Ongentys. Amantadine, various formulations including IR and ER, and the newer adenosine A2 antagonist, Nurians. In spite of these medications, some patients still have motor fluctuations, so they may still have off time in spite of being optimized on meds available in the market. So for that, we have trials for off time in PD, and one of them is looking at more continuous release of carbidopa, levodopa. There's also a therapeutic agent, tavapadon, that is being compared against placebo for patients with motor fluctuations, and a newer trial for looking at a new agent for treatment of dyskinesias for patients who are already carbidopa, levodopa. Now, this is an interesting new therapeutic option. It's being done at our center, and basically for patients who are already on levodopa and are still having wearing off, this is a non-medication option that they may have for treatment of wearing off. And basically there is a device that stimulates the small muscles around the ear. And there is thinking that this may possibly, because of the central nervous system connections between the ear and the brain, it may possibly take people from an off episode to an on episode. There are a total of 4 visits, and everything happens here in the clinic. The patient does not need to wear any device or do it at home. So when you come here, you get during different visits, different stimulation frequencies, and the idea is to gather more information as to what stimulation frequency may perhaps be useful to get patients from off to an on state. We also have trials for insomnia. So suvorexant is a medication that's currently approved, FDA approved for treatment of sleep disturbance. This trial is specifically looking to see if it is possibly of added benefit in patients with Parkinson's disease because it may have decreased physical dependence or rebound insomnia. Also a trial for patients with constipation. And the trial is not just looking to treat constipation, but also to see if it may prevent the formation of toxic alpha-synuclein aggregates. Another PD trial with constipation, looking at an agent enterin compared to placebo, and total duration of the trial is about 6 to 9 months. So thanks to these research studies, several new drugs have come to market recently, and several of our patients, and we've had the privilege of being involved in these trials before they came to market. One of them is sublingual apomorphine, was in trials a few years ago, and now it's approved. And basically, a sublingual film with apomorphine is put under the tongue, and it has a potential of turning people from off to an on state. And this is currently FDA approved and available by prescription. There's also the more recently available opicapone, which again, we had the privilege of being in trial, which recently was FDA approved. And it is somewhat similar to entacapone, but this one is only needed to be taken once a day and not multiple times a day like entacapone. Imbresia, which is an orally inhaled formulation of levodopa, which is to be used as needed during off times with Parkinson's disease. Duopa has been available for a while now, and it is intestinal levodopa that's directly pumped to the area of the intestine from which levodopa is absorbed, and which can make absorption more predictable. We also have trials for genetic testing in Parkinson's. This is becoming increasingly important as they are trying to develop meds that are specific for different genetic subtypes of Parkinson's. And the genes that they are specifically looking for developing therapeutic options is for the LRRK2 and the GBA mutation. And there are trials that offer genetic testing for free for patients with Parkinson's disease. Evergreen Health was proud to be a recipient of the Michael J. Fox grant for increasing diversity in PD clinical trials, and we are proud of that partnership. So if you wanted to have a more updated status of the clinical trials that are available at Evergreen, you can go to our website, which is listed here, and that'll outline the clinical trials in the various therapeutic states. And if you look, the second from the bottom says Parkinson's disease. If you click on that link, it'll give you an ongoing update of our clinical trials. And if you also go on our website, you'll find what it is like to participate in clinical research. And there are patient testimonials as well as the videos from our providers. So with that, I would like to finish my presentation and again thank the NWPF for inviting me, and for all of the listeners who are attending the HOPE conference today. And we hope that you'll participate in research here at Evergreen or at any of the PD facilities that offer clinical trials across not just Washington, but in other parts of the country, so that we can have newer treatment options available to treat Parkinson's disease. Thank you for your attention.